to the Leo Training Podcast with Joe DeLeo. You'll hear in-depth interviews and tips from world-class athletes, coaches, and industry-leading experts to help you train smarter and improve at what you love to do. Train smarter, get stronger, move better, race faster. Here's your host, Joe DeLeo.
Hey everyone, we're back with episode 21 of the Leo Training Podcast. This week's guest is Dr. Matthew Rice, and the topic of conversation is rehab to performance. In this episode, Dr. Rice and I will discuss how he evaluates and assesses his clients and patients in his clinic. This provides great insight to you, the audience, as to what you should be looking for if you ever have an injury occur, or what you should be looking for if you're being assessed as you go into and move into a strength and conditioning program. Before we roll into the episode, let me tell you a little bit more about Dr. Rice. Dr. Matthew Rice was born and raised in Southern California. After obtaining his bachelor's degree in human biology, Dr. Rice attended Cleveland Chiropractic College, Los Angeles, where he received his doctorate degree. Dr. Rice has worked in numerous clinical settings within the Orange County and Los Angeles areas, including the Cal State University, Fullerton Health Center. His lifelong involvement in martial arts, coupled with his devotion to weight training and physical fitness, have led him towards an interest in biomechanics and sports-related injuries. Dr. Rice is a certified provider for active release technique, functional movement systems, rock tape, and functional range conditioning. Dr. Rice also holds a kettlebell instructor certification with Strong First, as well as a corrective exercise specialist and personal trainer certification under the National Academy of Sports Medicine. His unique approach involves a combination of evidence-based chiropractic, functional muscular balance, soft tissue mobilization, rehabilitation, and patient education to eliminate symptoms, restore full function, and promote a healthy lifestyle. Without further ado, let's roll to episode 21. Rehab to Performance with Dr. Matthew Rice. Matt Rice, welcome to the Leo Training Podcast. Thanks for coming on to the show. It's an honor to have you here, my friend, and looking forward to getting into some exciting details in the strength and conditioning field and rehabilitation field.
Hey now, how's it going, bud?
I'm doing well. It's awesome. You look like you're enjoying some sunshine out there on the West Coast.
Absolutely. Yep. It rained this morning, but as you can see, it's pretty sunny and warm now.
Very nice. Much better than the East Coast has been treating us this past week.
Yeah.
So why don't you take a minute and talk a little bit about your background, who you are, where you're located, and what your practice involves and the type of individuals that you work with on a day-to-day basis.
Okay. So I'm in the United States, Long Beach, California. I am a chiropractor. I do a lot of different stuff, a lot of soft tissue mobilization, corrective exercise. I try and incorporate strength training and a lot of different stuff. Basically try and identify whatever the patient needs and try and fill that for them.
Awesome. So do you work with a wide range, your clientele? Is it, everyone from, somebody just that might be trying to get out of pain, the recreational athlete or, weekend warrior, or more serious athlete that's training for a competition?
Yeah, I pretty much see everyone, a wide variety of people. My office is inside of a gym, so naturally I see a lot of active lifestyle people. But I see everything from kids to, senior citizens, people that have a sedentary lifestyle, don't do too much as far as activity, to people that are doing Ironman, triathlons, all sorts of stuff.
Excellent. Yeah. So your clientele runs the gamut and the spectrum of ages from high school all the way up to seniors. Yep. Very cool. So why don't you talk a little bit more about sort of, your toolbox, so to speak. So you're Dr. Chiropractic. I know from speaking with you and following your work, you're also a Strong First level 1 kettlebell instructor, FMS, SFMA. So talk a little bit about how you sort of utilize all these, different disciplines and modalities and, blend that and integrate that into your practice and your approach in treating individuals.
Yeah, sure. I'll address the strong first thing first, I guess. I got into that from reading a lot of just Gray Cook, Stu McGill type stuff. That fascinated me with all the importance of kettlebell training. I wanted to implement those sort of things into rehab work with clients, and I wanted to know exactly what I was doing. I wanted to learn from the best. I started training with my buddy Eric, who owns Long Beach Kettlebell Club. They do like kettlebell sport there. So I started with that, and then just kind of started following a lot of RKC and Strong First stuff, and then eventually just kind of told myself, look, if you're going to be teaching this stuff, you better know what you're doing, and just made that decision. I think I read online somewhere they said give yourself 6 months to train for it, and at the time the only one nearby was like 2.5 or 3 months away, and so I just signed up and just
went for it. That's awesome, man. That's right. So you, I know we were kind of paralleling different times. I went to mine in August. I think yours was April, May last year.
Yeah, it's about almost a year ago, or about a year ago.
Awesome. So I got to ask. I know how my experience. How was your experience?
My experience was tough, man. That snatch test was brutal. So one of the things, and we talked about this, when you were getting ready for your thing, and I tried to give you, 1 or 2 pointers. The thing I had the most difficult time is so the days of actual training is, I always use the required weight, all the pressing, all the swings, everything I was using the, 24 kilo and up. And, by the time day 3 came, my hands were chewed up, and, you're fatigued and just drained. And obviously that's when the snatch test is. So it was no joke. That was brutal.
Yeah. It's tough. It's, looking back, it's the cumulative fatigue and the wear and tear that mounts over the course of 3 days, and then you're graded on your technical ability for the 6 lifts, and then the 5-minute snatch test. Yeah. So you're you gotta be conditioned, and hopefully you're at the end of that. Hopefully your hands are holding up, because the same thing happened to me. I ended up tearing my hands during the test, and I'd never done that before. Yeah. So I guess that's the time to do it, though. If you're gonna tear them.
Did you feel you were well conditioned when you went in? Did you feel prepared?
Yeah, I did. I really kind of tapered down for it quite a bit. So I went into that last week and a half to 2 weeks and really backed off quite a bit, and I knew I was in a good spot, because after the first day, I felt like, I really just kind of warmed up after the first day. And then after the second day, I felt tired, but it felt like a normal level of training fatigue. And that's kind of just, I wanted my body to be accustomed to that going into that weekend. And, so it worked out well, and definitely appreciated your advice and stuff along the way. I'm glad that, I was able to connect with you and everything. So it's always good to pull in, perspective from different people, especially if they're going through it for the first time, because it's so fresh in their mind.
How many times before you did your cert did you do the actual snatch test?
That's interesting. So initially I was only doing it once a month. So when I tested at the end of May once, and then in June, mid-June, actually, I also talked to a fellow instructor I've had on the show, Philippe Thiel, and he suggested start to test weekly.
Okay.
So I would start to do a snatch test once a week on Sunday, and
about 4 to 6 weeks out, I hit it. So I just kind of started at that point. I just started to really just focus more on technique and stuff at that point, and kind of just trying to refine my form as much as possible before the certification. But yeah, so I had it a couple of weeks out, which was good, which was helpful.
Did you ever practice with like a heavier bell? Did you try?
Yeah.
Okay.
Yeah. I didn't do the snatch test with a 28, but I would do, probably in the 8 to 10 rep range with a 28 kilogram bell. During the earlier in the week, like usually on Wednesday and stuff, and just kind of work on, being able to generate more power, keeping it lighter. And then when you go to the 24, there's a little bit less effort and stuff.
You think you're going to do level 2?
I am. I'm planning on it. So the game plan for me right now actually is, so I was at the SFB last weekend.
Yeah.
I did not pass, which was pretty disappointing. I hit the one arm, one leg in practice the week before.
Okay.
But did not hit it at the certification. So my short-term immediate goal is to continue with my training for that and get that,
nice.
Finalized and finish that first. And then I'm going to probably turn my sights towards the level 2 after that. Okay. But I'm going to give myself a much extended ramp for that one, because for me, I think I'm going to need to press right now, currently with my body weight, I'm going to need to press the 44 kilogram. Yeah. So that's a big jump. That's a big jump. So what I've been doing, actually, this is really cool. So what I've been doing is, I've been researching kind of how to progress. Brett Jones, Chief SFG, has a level 2 plan up on the Strong First site.
Okay. And
then I recently just purchased Jeff Newpert's Kettlebell Strong, which covers all the double kettlebell lifts. And he takes I'd never seen this before, but his approach is you start with the rack and the front squat as the progression for the double kettlebells. And the idea is that the front squat is essentially a moving rack.
Okay.
So what I'm going to do is, once I get the one arm, one leg, and I have the SFB, I'm planning to have my programming be 2 weeks of body weight. I'll do 3 days a week of body weight, 2 days of simple and sinister, and then 2 weeks where I'll be doing 2 days of simple and sinister and 3 days of double kettlebell work. And I'm going to kind of go 2 weeks of body weight focused, 2 weeks of double kettlebell focus. And the idea is to really focus on the hanging leg raise and eventually the handstand push-up. And what I want to try to do is I'd like to see if it's possible to get the half body weight press by training handstand push-ups and not by actually pressing the bell. As obviously you're going to test it and check to see where you are, but I'm curious to see if it's achievable by training strictly body weight, pretty much.
Interesting.
Yeah.
Have you noticed anything, when they talk about like the what the hell effect, have you noticed anything in regards to any of your other training, whether that's rowing or anything else, in any of that has improved after you started kettlebell training?
Oh yeah, absolutely. Conditioning for sure has transferred over tremendously. Just the ability, I would say, especially for any endurance athlete, especially rowers, because it's more of a power endurance sport. It's not a longer event like a triathlon or a marathon or half marathon. Even if you're racing in the men's or women's 8 or the single, the longest you're looking at 5:20-ish to maybe 7:30, depending on the conditions in the boat class. So all the races are well under 10 minutes, right? So the conditioning aspect from kettlebells is your ability to generate high output of power and condition yourself to recover between high bouts of exercise.
Yep.
I mean, that's not only what a single race is of rowing, but it's a regatta. So the way rowing is kind of structured is that the Olympics and a lot of the collegiate regattas, you have multiple races over the course of anywhere from 3 to 4 days or up to a week. So you need to be able to go flat out for a 2K, depending on how you do. If you win your heat, you would go to the quarterfinal. But if you place, then you might have to go to a repechage. So you could be racing anywhere 3 to 5 times in a week.
Wow.
So that's the endurance component, right? The ability to recover.
Yeah.
And then repeat a very, very high intensity effort over the course of multiple days. Yeah. So the conditioning aspect is just transferred over completely. And one of the things that I love about all the Strong First stuff, especially the body weight and the kettlebells, is the ability to train each side, the right and left, independently. Get-ups are great because it's not just a strength training movement, but it's an assessment of strength on the left and right side. And especially for sweep rowers, it's unbelievable how that's an issue. They have such a hard time, rolling and driving to the elbow on one side. Can't do it. So that's like huge weakness. And for me, training for the one arm, one leg, like recently, it all comes back to rowing. So I spent 15 plus years rowing port and just a couple years sculling. So I was rotating out to my right side and I would push off on my right leg more. So for me, I was probably the only guy at the SFB that was testing as a southpaw, so to speak. So I was trying to do it with my left arm planted and my right leg planted, and everybody else. But if you think about it from the side that I rode on, I was initiating with my right leg. So my posterior oblique subsystem, from the left lat down to the right glute is really strong.
Okay.
But on the opposite X, right lat to left glute, not so strong.
Yeah.
So as I could progress through my training, it just became like more apparent that asymmetry just showed right back up.
Interesting.
Yeah. It's great. It takes you right back to humility right there because of the sport. It makes you realize you still got a lot to work on to try to get some balance.
Yep.
So let's let's bring it back to you because I've been rambling for about 5-6 minutes here, and you are the guest of honor tonight. So let's talk a little bit about some of the work that you do with your clients, and I guess let's just start off how do you, when you work with someone that's brand new, how do you take them in? How do you assess?
Okay, so assessment is basically kind of like a hybrid of everything I've kind of learned, accumulated over time. So FMS is one thing. That's probably been one of the most important and eye-opening things for me, is to kind of assess movement patterns or look at how people move. In chiropractic school or PT, whatever, you're taught these physical exams where you're testing, someone's ankle or elbow just in isolation. You sit down and I kind of see if I can bend or rotate your elbow, how much, all that sort of stuff. But it tells you nothing about how that elbow or that shoulder or that ankle moves in more of a realistic movement. Something as a squat or a push-up or a lunge or walking up and down stairs. So I use a combination of like FMS, SFMA, stuff I've learned from anatomy trains, more like body reading, postural assessments. Let's see. A little bit of gait analysis. Some stuff I've picked up from Stuart McGill's books. Vladimir Yonda, a couple of things. He has a hip extension test that I really like. So combination, a hybrid of all those different things. I kind of, to give you an idea, I start out usually having them go through all the toe touch, extension pattern, flexion. I want to just see how they move. I want to see how their hips move. I like to look at balance and single leg standing. So I have people stand on one leg. I usually time them. How long can they stay on one leg? And while they're doing that, I look at everything. So they're always barefoot for the assessments. I want to see what's going on with the foot. Is there any shaking? Is there pronation? Is the knee having any sort of medial rotation or valgus collapse? What's going on with the hips? Is there any deviation to one side or the other? Their face, do they grimace? Do they have a hard time standing on that leg? And then I time them, and then I compare that to the other side. If there's any sort of asymmetries, then I go deeper into that. So from there, I go into a squat. I do kind of the FMS style squat, heels on the floor, heels up on the plank. I like doing a single leg squat, kind of the way they learned, or kind of the way they teach in like an ASM, like the CES. And I like to look at same thing, ankle foot complex, any valgus collapse of the knee. And almost everyone has something from that single leg test that kind of stands out to me. After that, I pretty much do majority, if not all, of the FMS tests. I don't do it like where I do score them just for the sake of at the end of it, I want to do pretty much what they recommend, which is cleaning up the ones, the asymmetries, all that sort of stuff. But I don't necessarily tally up the final score and use that as kind of my limit of whether they can or cannot continue to do their sport. I just kind of like looking at those things. If there's something that stands out to me that I want to do other tests, or I want to do something outside of that, like some of the Vladimir Yanda hip extension tests are really cool. I usually can pick up a lot on that.
That's awesome. So one, thanks for being so in depth and transparent regarding the assessment process. That's really cool. So two things off the bat. So one is, can you kind of go over, for anybody that's not familiar with, what is the body scan involved from Anatomy Trains, and then can you talk a little bit more about the Vladimir Yanda, the hip assessment that you do?
Yeah. Okay. So for Anatomy Trains, I'll do that usually with them in shorts and either a tank top if it's a male, shirtless, and I'll have them face me, then face to the side, face away, and face the opposite side. So you get a quick scan of all four directions, and you kind of look at what pattern stands out to you. What do you notice the most? And then you go from there. And so you make quick notes. You don't spend too much time analyzing or thinking about things. You kind of just make your little notes. Is there a elevated shoulder? Is the pelvic shift? Is there any rotations or tilts of the ribs? Stuff like that. And then usually, I make notes of all those things, and then that's just kind of put into my exam when I kind of put together their treatment plan.
Awesome. And then can you speak a little bit, what's the Yanda, the hip assessment involved?
Yeah. Okay, so you got one where you're looking at hip extension. So this, the patient or client is face down on the table. You have them elevate one leg. So usually I'll lift up. If they're not shirtless, I will lift up their shirt so I can see the musculature of their back and their low back. I'll have them lift one leg up towards the ceiling while keeping the leg straight. And then I usually look at, I have them do like 3 reps. And usually I just kind of stand back and I look at it and I write down what stands out to me. I'll have them do 3 reps on one side, 3 reps on the other side, and then I have them relax, and then I do that again. And some things that I'm looking for is any rotation in the pelvis. So when they go into hip extension, do they have the ability to have the spine in kind of a protected, neutral position, or is there rotation of the the spine every time they go into hip extension. Another thing is watching the pelvis in regards to any forward or posterior tilt. So a lot of times I'll see with people is their lordotic curve. Okay, if you're looking at the curvature of their low back, if they lift one leg up and I see that curvature increase a lot, that tells me that there's possibly some tightness along the psoas or some sort of front line musculature that causes them to go into that anterior pelvic tilt. Another thing to look at is kind of the tone of the muscles and how they respond to hip extension. So a lot of times with certain people that basically, for whatever reason, the glute is not firing. I know a lot of people disagree with that, and I'm just using that as kind of a broad term, whether that's true or not. It gives me good insight into what's going on. If I see every time they lift that leg into hip extension and that erector spinae lights up and gets huge on one side, and the other side is not doing so much, that's to me that's important. And usually there's an asymmetry. So if I see that, that's an important thing to me. And that kind of gives me a good understanding. If someone says I have back pain every time I squat, or I have back pain when I do sprints, that's an important thing because their glutes they're not the prime movers for that hip extension. You're seeing this, this erector spinae muscle that's becoming so dominant in that pattern that, you have to do something to correct that.
Right. Yeah. The body doesn't necessarily care about quality. It just wants to get from point A to point B.
Exactly.
Yeah.
Yep.
So that was awesome. So for those in the audience that aren't as familiar, right? So everything you just described. So I guess very, very simply, why is that? Like, why would that be important for them to, like, why should they care? Like, oh, my glutes aren't working, but my lower back, the muscles that are run along the spine, the erector spinae, they're really working hard. They're working overtime. Why is that important? Why should they care if their lower back's working a lot more compared to their glutes?
Great question. Okay, so here I'll try and think of a couple examples I've had, like in a clinical setting. And so let's say 40-year-old office worker, male, chronic back pain. There's a couple different ways of assessing this, but let's say I do something as simple as placing him on his face down and having him do that hip extension test. If I notice he struggles to get that leg up, he rotates too much, and that erector spinae or his low back muscles are just really spasming and cramping up or tightening, and I a lot of times I'll palpate the glute muscles or hamstrings. I try and feel for actual activation in those muscles. If I feel that the glute muscles or hamstrings aren't doing much, but the erector spinae is, that's a good indication of why that person is having this chronic low back pain. Possibly we need to teach him some movements to activate or stimulate his glutes, or teach him maybe how to hip hinge a little better, make him move from his hips, not so much from lumbar flexion. So that's usually a helpful thing. Another thing I've had is in the gym I'm at, there's a lot of bodybuilders. I've had a lot of bodybuilders that have come in with chronic low back pain. And, these are guys that squat very heavy, lift heavy, deadlift, very heavy. And you look at them and some of their erector spinae muscles are enormous. And a very important thing is when I'll do that test, you'll see when they do that, the glute muscle is just kind of, it's working, but it's nowhere in comparison to what their erector spinae is doing. So for them, you do things like a single leg bridge or a single leg deadlift, and they have no control and no ability to work in that plane or on one leg. And so that's a really helpful tool in regards to identifying that problematic pattern or dysfunction.
Yeah, absolutely. That's a great visual for those out there that are listening. That actually just jogged my memory because last year I went to the Rock Tape FMT certification, and Perry Nicholson was leading it. And so he did the thoracolumbar fascia taping. Yeah. And the guy that he had taped, exact everything you just described. Erector spinae muscles were huge, and he had low back pain. I believe it was almost sciatica. I think he had nerve pain running down his leg, and put that application on and like stood up and boom, it was gone. It was unbelievable. But the thing that was amazing was you looked at his back musculature and the muscles that line the spine on the left and right, those erector spinae, were so big's not the right word. They were so developed. They were huge, and it was unbelievable. So I'm like, I think about what you just said, and I'm like, wow. I'm like, that makes total sense to me now thinking about that.
So it's not a matter of having weak muscles or anything like that. It's just probably like a motor control type thing. So for me, I'm not actually looking for like a weakness. It's more about looking for the recruitment of what muscles, the kind of the pattern, and do they have a motor control issue? Because most bodybuilders aren't weak in any sort of thing like that, but there is often a motor control type thing where they can't stabilize, the spine and move through certain planes.
Right. That's a great point. So when you're doing some of those tests, right? So for example, would you also, evaluate to see if not only, say you just mentioned the glutes aren't firing, but another instance might be their glutes are firing, but the sequence, right? So they recruit the erector spinae and the hamstrings, and the glutes are the last ones to fire rather than the first. Yeah.
And in real life, it's not necessarily the glutes aren't firing. I know some people. It's just kind of a way of describing it. Like that's the terminology I'll kind of explain to patients because I'm not speaking to a neurologist most of the time. So just to break it down to patients, I'll explain it kind of like that. But in regards, it's kind of just a motor control dysfunction.
Okay. Okay. So I remember this too from some of your work, and you mentioned you like to assess your clients and your patients barefoot.
Yes.
Right. And I remember at one point you had an Instagram post, and I believe it was somebody was either doing single leg deadlift or maybe it was kettlebell swing. But you talked about how just doing those type of movements help to strengthen the arch in the foot.
Yeah. Intrinsic muscles, the arch.
Yeah. So could you talk a little bit about, one, the barefoot training aspect, two, why that's important, and how that the arch in the foot kind of translates all the way up the kinetic chain?
Yeah, well, okay. So there's a couple different things. So I just find it very interesting, like reading about different types of barefoot training and stuff. I'm just very fascinated with that. And a lot of the science and research just makes sense to me, right? It makes sense that the human body should be doing more things the way it was designed. It just makes sense to me. But a lot of patients will come in with certain injuries, whether that's hip, knee, ankle pain, whatever. And I can tell a lot sometimes just by watching them stand barefoot and move through different exercises, whether that's a squat, single leg deadlift, kettlebell swing, stuff like that. So just the idea of the feet, sure you're aware, like proprioception, all that sort of stuff. For those who aren't familiar with that term, is just basically another word for kind of the sensory feedback that tells you where your body is in space, right? So if you think about, the highest concentrations of those proprioceptors are found, the foot, the SI joint, and the neck. If we're constantly wearing shoes that are basically dampening the sensory input to the system, then it just makes sense that something along the lines is going to go wrong. One of the analogies that I try and give to patients when I try and explain to them the importance of doing some of their activities barefoot, I'll kind of give them this analogy. So if you take, let's say, a 45-year-old guy who sits at a desk for 6 to 8 hours, He has a deconditioned core, doesn't do much as far as physical activity. And then he goes out once a week and, plays golf or something like that. It's logical to expect him to develop back pain, right? At some point.
Yeah.
So what is the proper way of addressing that? Is it to just give him a back brace? Or do you think we should possibly maybe give him some hip mobility, possibly some core stabilization, go over some, movement training type stuff, and then that addresses the actual dysfunction. So the way I kind of give them that in regards to their foot, it's the same thing. If you take someone who wears high heels or, tight footwear every day, and then they want to go out and they want to run, or they want to do yoga, they want to do something once a week, the conditioning of the foot, the muscles, the connective tissue, all of that, it's logical to assume that that's going to break down because they don't do anything to strengthen or stabilize it or bring it to the level that they're going to challenge it, right?
Yeah, those muscles are not being used, so they're atrophying. Atrophied, yes. Yeah, it reminds me of it reminds me of the scene in The Matrix where it's like they pull Keanu Reeves like out of the Matrix and he wakes up and they're like, he's like, my eyes hurt, I've and you're like, why? Yeah, because I've never used them. It's like, dude, you never used your eyes are muscles. You never use them. Well, it's like, why is my foot hurt? Because you're in a shoe all the time. And the muscles that you should be developing and constantly using because, we're a bipedal animal. We get around on 2 feet. We're in shoes all the time. So those muscles aren't being developed to the best of their ability.
Exactly. So there's an interesting. Have you seen that image? You said your girlfriend is a neurologist, neuropathologist. She's probably familiar with this. So there's something called a cortical homunculus. It's basically. Have you ever seen the image where it's like the cortex of a brain, and then it shows the different regions of the body part, and they're all kind of different sizes?
Oh, I know what you're talking about. Yeah.
I'll send you a picture of it, but it's basically it's like a map of showing the different areas of the body and how much sensory input is at each location. So it shows like you pick a side view of a brain, and it has each body part, and they're all kind of proportionate to how much sensory input is at that location.
Awesome.
So it shows like the face is very enlarged, the hand is very large, the lips are very large, and the foot is very large. And then other things like the arm, the leg, the midsection are very small. So it's just to show you the amount of the sensory input at each of those locations. And it's just fascinating because if we understand the face, the hands, and the foot are all these things that are very important, then why are we doing something as putting something like a shoe on the foot all the time that's basically limiting the sensory feedback and kind of closing it off from the environment,
Absolutely. Yeah, that's the first thing when people walk into to the studio where I train out of. Like, I just I'm already barefoot, so they're like, "Oh, you want to send socks?" I'm like, "You can wear socks if you want. I prefer barefoot."
Yeah.
I mean, it's just and to your point, I also remember at some point over the last year. This is awesome. You had a video on your Instagram, and it was side by side comparison. Guy was doing a kettlebell swing in I don't know, maybe like Air Jordans or something, and then the next one was like barefoot, and you're like, no coaching took place.
Right. Yeah,
all you did was just basically just take him down to bare feet, and it was unbelievable how much better his technique was.
Yeah, and I'm not BSing you. There was nothing. I had him. I've taught him swings before. He's actually a runner and a track and field athlete. So I was teaching him kettlebell swings, or actually, he told me he had been trained in kettlebell by his strength and conditioning coach. And so I was like, okay. So I had to work with him a little bit, but he was doing the swings in running shoes, and I just I looked at it. I said, okay, this is obviously interesting. So I took video of him and I said, okay, take your shoes off. Let me just see without any cues or any coaching, I just said, let me see what it looks like with your shoes off. And it cleaned it up like immediately. And I didn't tell him anything. It was bizarre. And it was just because, as there's a huge, iron bell or steel bell swinging back and forth, your body has a very challenging time, figuring out where it is in space and trying to shift weight, and his feet can't grip the ground and his toes are compressed in this narrow toe box, and it has, no ability to see what's going on or to understand, in relation to the floor and environment, what it should do.
Yeah. Hopefully that's like crystal clear to everybody that just heard you say that, because like that's like one of the points I try to get across too, and that's so important, because I mean doesn't matter what sport you're doing. I mean, you're a runner, you're a rower, you're triathlete. I mean, you're a power lifter. Doesn't matter. You're still in contact with the floor. Maybe the only one is like swimming.
Yeah.
But regardless, all the other ones that we mentioned, you're in contact with the ground. You're generating force through the ground that's transferred up through the body.
Exactly.
Awesome. All right, so let's kind of shift gears a little bit. So, couple questions. So, one is, I've seen you do this like several times on Instagram, and this has like really piqued my interest. So you've got this kind of setup on the cable machine where you have like it's either like a strap or a harness, and you're either doing like side bridges, but you kind of note in your Instagram posts that you're kind of trying to work, and correct me if I'm wrong, like along the fascial lines. Is that accurate?
Yep.
Okay. So can you kind of give some context to the audience, explain what the setup is, and then what the kind of purpose is and what you're trying to get out of that?
Sure. So you're referring to the physical industry strap. I kind of started using some of that with the Gray Cook band a while ago. Then I actually saw Craig Levinson, a chiropractor out of LA. I saw him using it, and I was like, that's actually perfect. So I started implementing a lot of exercises that I saw him using. So he does like, this side bridge, other kind of rotation or anti-rotation exercises. Then I've just started kind of playing around with especially like the spiral line and the functional line in regards to anatomy trains. So I've had some patients come in that have had kind of rotational weaknesses, I guess I'll call them. Meaning like during their back squat or Olympic lifts, they either feel or I visually see some sort of collapse into one hip or some sort of rotation. So I've just played around with different things. Kettlebell, Turkish get-ups have been one thing that I was really using to try and fix those things, and that's been helpful. But I started using that physical industry strap and having people do a lot of rotational or anti-rotational movements. So and sometimes it becomes when I'm having them do, let's say, an exercise, it becomes a very good assessment. I'll see a lot of things when they're doing, let's say, if I hook them up with that strap in kind of a rotational pattern, and I have them do, sometimes I have them do like a lateral bear crawl. Sometimes it's a reverse lunge. Sometimes it's just standing on one leg. So the resistance is pulling them it's pulling them posteriorly, but also in a rotational pattern. So I'll kind of see some sort of asymmetries or weaknesses when I do that sort of stuff. So it kind of gives me just a better insight into what's going on. And then we address the weak side. And I've had a lot of people in weightlifting and Olympic weightlifting that have one side, kind of weak, or there's one side that's dominant when they do all their overhead lifts. So like their snatch and stuff like that. And they'll feel, when I pull, this side, pulls first. This side, when I front squat or back squat, I feel like my hips rotate in here or they deviate this way. So I have them work some of these rotational patterns, and a lot of times just really having them train that weak side over and over, they feel like they get more balanced, things feel more symmetrical, and they feel more powerful pulling off the ground or back squatting, stuff like that. So I just kind of look at some of the way the Tom Myers lays out the fascial connections and the trains and stuff like that, and try and just figure out, like, along those obliques, how we can train that. If there's something that exists as these spiral lines that, cross the body, and one can be tight or one is short or weak or whatever it is, if we can kind of balance them, then maybe that'll make them perform better or make them a better athlete, or, whatever it is.
That's awesome. That's awesome. I'm going to have to play around with that a little bit.
Yeah.
I'll see if I can. Find that on Instagram and then try to embed it in into the post for this episode. I think I might be able to do that. So that'd be kind of cool. That'd be cool. So one of the other things that you do. So on Friday nights, you get together with a buddy of yours, Bushi Doni. Mm-hmm. And so why don't you talk a little bit about, like, what you guys do on Friday nights and the group or individuals that you work with?
Sure. So my buddy Sydney is a yoga teacher. He trains at a studio called Purple Yoga. They have a couple different locations. We do it at the one in Long Beach. So I just started practicing with him as just a student a long time ago, about a year or 2 years ago, something like that. And he had come to me once he found out I was a chiropractor, and just kind of wanted to, incorporate me into the class somehow. Figured I could add something, help out, and we've kind of met a few times and kind of brainstormed a few ideas. I told him what I think would be beneficial to teach the students. He told me what he thought would be cool, and we just kind of came up with doing some kind of, we call it posture and prehab. So basically we just, during the class, I'll try and go over some things that are, whether it's corrective exercises or teaching them some self-myofascial release techniques using, like, a lacrosse ball, things of that nature. We've started to get into some of the anatomy training's actual lines. So, like, there are certain yoga postures or poses that lengthen specific lines. We've, sometimes I'll talk about some of those. We'll do the specific poses that actually lengthen or balance those lines. And then we'll try and work on some self-myofascial release techniques to some of the areas that get kind of tight or develop adhesions in those myofascial structures.
Awesome.
Yeah.
That's cool. So everybody walks out of that class feeling a lot better.
Yeah, and actually the last couple of weeks is we've done Turkish get-ups in the class, which was awesome because, if you're dealing with, like a class full of yoga instructors, typically flexibility or mobility is not usually an issue, right? It's usually a stability component. So it's usually trying to create, strength or stabilization in different systems. So, Turkish get-ups are really good because you get a lot of hypermobile people, and you get them learning how. I have them do a strong first plank and create tension, teaching them about irradiation, stuff like that, and then have them do some Turkish get-ups. So it's pretty awesome.
That's awesome, man. That's cool. They must be pretty fired up after trying that stuff out.
I hope so.
That's awesome. Very, very cool. So can you talk a little bit about, I know you've just done recently the first level of Thomas Myers Anatomy Trains, the KMI program. Yeah. So what's that experience been like? That
was cool. So pretty much with, so it was like a 10-day course, right? So it's a long workshop. It was very good. I wanted to basically improve my soft tissue mobilization, manual therapy skills. And 2, I wanted to learn the material better. I wanted to be able to, I wanted to know more about structural integration. And it was a great experience. It was cool. I'm kind of debating if and when I'm going to do level 2. I think I am going to. I just haven't decided when I'm going to. I did this one in Portland. I'd like to do the next one in Maine at their headquarters. But along with that, along with other things that I've done, it's kind of not challenging, but it's interesting, kind of figuring out how to include all these different systems into like your practice. To take like the FMS stuff, take the anatomy train stuff, the FRC stuff that I just recently did, and try and incorporate all that into your training. So, I don't want to follow one system. I just kind of want to learn as much as I can and use all of these different things to, get the best out of it.
That's right. That's what it's all about. And then just, helping people get better.
Exactly.
Right? So it's like whatever tool is going to work for the job to help the individual.
Yep.
Very cool. So what's the, I know you're fresh out of the FRC. That was last weekend.
Yes.
So how was that, man?
It was cool. So, I think so far, for the last week, I've been kind of rereading over the notes, trying to figure out how and when to incorporate it. And as of now, the things that I liked the most was the cars that controlled articular rotations. It's very fascinating. So I've been actually, even the first day I was back, Monday morning, I incorporated that with a few of my patients, specifically for the shoulder, like the GH joint, and their hips as well. So trying to just get the ball and socket joints moving a little better. Also scapular control. We went over some really cool scapular coordination, drills, exercises, whatever you want to call them. But I've been incorporating them with some of my patients. It's been pretty interesting.
Awesome. Good results so far?
Yeah, I have a few. So one of the things that they, talk about is how you have to do these things like daily, right?
Right.
It's not something you train 3 times a week. It's something that, if you want to see results, you have to do this, every day as much as you can. So I have certain patients that have told me, like in the morning or every time at lunch, they go through these articular rotations and they feel their mobility, range of motion is improving and stuff like that.
That's
so
awesome.
It's cool.
And I know, like, one of the big things, at least, from my perspective, reading over the material on the website for functional range conditioning and stuff is that people kind of on the surface right away, the first thing is they see this like really good ability to move and there's an increased range of motion and mobility. But like, I think one of the things that they make sure they drive home is it's also very important that they demonstrate control.
Yeah, exactly. It's not like they go over, it's not about, doing passive stretches or just grabbing a band and, stretching your shoulder or pec muscles. It's trying to train, your end range through active motion.
Right.
So
they really want the nervous system tapped into.
Exactly. Yeah.
Yeah. I think that's right up my alley.
Yeah, you're doing it soon, right?
Yeah. That's the goal this fall. Cool. September, October. Cool, man. All right. So, is there anything else that you want to cover before we go to rapid fire?
I think that's it, man.
Awesome. All right. So this is the fun part. I love asking everybody these questions. One sec. Let me get this up. Hold on. Sorry, grabbing the questions.
What's your favorite kettlebell lift?
Oh man, I love the get up.
Yeah.
I love that one. Yeah, the get up's great because you can just you can pull so much into that lift. Like you can do a half military press in the lunge position. Once you're standing, you can go to a bent press, a windmill. You can go to a squat, you can go to a snatch. I mean, it's just there's so much you can integrate into that movement. And like when I had Jeff Sokol on, like he's just so candid. Like he's just like, yep. He's like, your life pretty much sucks if you can't get up off the floor. He's like, I think it's a pretty important skill, and it's like you can't really argue with that, right? So I was like, well, I'm gonna follow suit and just start doing 3 get-ups a day, and see where that gets me. And it's unbelievable. I mean, it's such a good movement. I mean, I love them all, but that's the one that I probably is a mainstay in my practice consistently, day in and day out. And the other ones, I haven't really touched the snatch much since the certification at all.
Okay.
I really like the clean. I feel like the clean doesn't get enough love. Just because, and I say that because it's such a important step between if you don't have a good clean, that's like the clean sets up the front squat, the military press, the snatch, and then the bent press, the windmill, or not the windmill, but it sets up a lot of those movements, or even the jerk, the jerk and press, a lot of the stuff for the level 2, and I think the clean is really good. I watched, I recently got Mark Rifkin's Super Lats. Okay. And that entire DVD, it's really all around the clean and the lat and getting that lat contraction. He talks about squeezing a sponge, or they say now squeeze an orange under your armpit, and really being able to, when you go to extend the arm, you're really just wedging yourself under and using that lat to drive yourself under. So I like that because I think it's such a good platform. And then as I mentioned earlier, with the Kettlebell Strong DVD and booklet from Jeff Newport, I mean, the first thing he does in the beginning of the DVD and the booklet is just get to the rack position in the double kettlebell clean, and he just has you rack it, and then you go over a cue, and then you put the bells down, and then you pick it up, and you go on another cue. And basically, you're just layering tension in the double rack position. And he just is, again, he reminds me of Jeff in a lot of ways. He's very upfront. He's like, well, you need to get comfortable being uncomfortable. You got to embrace discomfort. And it's true. Sitting with a pair of, 32s on your chest, it doesn't feel too good.
Yeah, no way.
Right? But you do that for a good amount of time, you're going to get pretty freaking strong, and you're really going to learn how to breathe behind the shield well.
Yeah.
Right? So those are kind of some of my favorites. How about you?
Get up and swing, I think.
Nice.
Get up, swing. Well, I also love the front squat too. So
yeah, I see you doing the front squat quite a bit. Yeah, I'm gonna be. That's actually so that program that I mentioned, that hybrid 2-week body weight, 2-week double kettlebell. That's what I'm gonna be doing. It's gonna be 3 days of basically getting in the rack position, and I'm gonna be doing a lot of front squatting.
Yeah. So
I think one day I might just do volume at 24s, and then another day I might do a 3-2-1, but a ladder, meaning I'll do 3-2-1 at 24, and then move up a bell size, and then move up a bell size.
Nice.
So yeah, so I'll keep you posted on that one. Yeah. All right, man, you ready?
Yeah.
All right, here we go. All right, so Matt, given your current knowledge level and experience, if you go back in time, what advice would you give yourself 10 years ago?
Let's see. I'd probably 10 years ago, I'd probably spend more time. I'd do even more workshops, more seminars. When I was in school, I think the one thing that was good about that is I was pretty diligent about going outside and learning as much as I could outside of school. So I would probably just tell myself to continue doing more of that, because what you learn in school, regardless of what your profession, that's like a fraction of what you are going to do in practice. So the stuff that I've learned after school, after college, has been majority of what I use. So I would say just keep going out there. I would probably try and actually link up with other professionals while I was in school and try and just kind of learn from everyone, because it's such a fast track thing to learn, to get so much information. You meet with someone who's been doing it 20 years and you shadow them for 6 months, you get so much knowledge. So I probably would have spent more time doing stuff like that.
Awesome, man. I love that. All right. If you had to pick one, what's your favorite strength training exercise?
Let's say kettlebell swings.
All right. Awesome. Okay. How's your training changed today compared to 10 years ago?
Oh my God. So a lot. 10 years ago, I was probably doing bench press 3 times a week and bicep curls 3 times a week. And nothing is the same. So yeah, I would say I've incorporated a lot of different stuff. I actually try and put one day, and this is kind of an interesting thing. I was reading something from someone else actually about this, but I try and dedicate one day to a different type of activity, meaning it's like one day is kind of like climbing, stuff like that. One day is, strength training, whether that's kettlebells, weights, whatever it is. Another day is just like running. Another day is body weight stuff or yoga, stuff like that. So I try and incorporate all the kind of different types of, what I believe human movement should incorporate.
That's awesome. Keeps it fresh and fun.
Yes.
Awesome. What injury have you had, if you've had one, and how did that injury change your training?
Great question. So my left shoulder, and this was actually what spawned or what kind of led me down the path of what I guess we'd call like the functional approach. So when I was in school, I had my left shoulder would bother me when I would bench press and when I would box. So I box with my left hand or my left leg forward. So my lead jab is my left, and it would fatigue very quickly to the point where I could barely hold it up when I was boxing. And I saw a couple different doctors and therapists about it, and you get different answers or solutions to that problem. And some of it was take these muscle relaxers or anti-inflammatory, or stop boxing, stop lifting weights, that sort of stuff. I had a teacher named Dr. Jensen when I was in chiropractic school, and she had a class called functional assessment. So in the class, we went over things like, we did gait analysis, posture analysis, but we also looked at movement. She actually exposed me to the DNS stuff, dynamic neuromuscular stabilization. She exposed us to Vladimir Yonda stuff. She introduced me to Stuart McGill and his stuff. Also, Craig Liebitson actually would come to our school because we were in LA. So he'd come to our school and teach workshops. So the stuff I learned from her kind of was all about, muscle symmetry, imbalances, stuff like that. So I started just to kind of go through and look at my training and look at what type of movements I was doing and which ones I was not doing. So I was doing, basically it came down to me having poor scapular stabilization, a lot of overtraining of the anterior musculature, so like pec minor, anterior delt, stuff like that. And I just had to kind of work a lot of shoulder mobility stuff, try and rebalance the shoulder and scapular muscles, stuff like that. So, definitely my left shoulder kind of was a big thing. Wow.
And it sounds like you had a really good educational experience, awesome teachers and material in the chiropractic program.
Sure.
Very cool. What's one thing high school athletes should be doing more of to complement their training and their health?
Let's say meditation.
All right.
Yeah.
Okay. So, given that, right? So what's, can you give like a quick like example that they could apply, right? So for someone that's not familiar with meditation, say that, high school athlete, 14 to 18 years old, something they could put into practice.
Yeah. Basically, I think that would allow them, there's so many different benefits of that. Do you want more of examples in regards to their training, or just
like, let's say like an example of a meditation exercise that they could do maybe like for 5 to 10 minutes or something.
Okay. Yeah. Well, a lot of people recommend just basically sitting and trying to concentrate on a word or a thought or something along that nature. And it's tough. I tried to meditate for years and it never worked for me until I actually underwent some sort of training. So it's hard to kind of teach yourself, but I think high school, college athletes would benefit a lot from just incorporating stuff like meditation into their practice.
Awesome. What's your best tip to improve recovery after a training session?
I would say some form of flexibility or mobility or recovery training. And that could be, static stretching, just going through mobility work, foam rolling, whatever it is, something like that that's going to allow all the systems to kind of recover a little better.
Awesome. All right, final question. What's one book everyone should read?
Well, for this audience, I'd say Movement by Gray Cook.
Awesome. Very cool.
How about you?
Oh, man. Let's see. Yeah, you know what? The one I just read right now recently that I just finished was Todd Hargrove's A Guide to Better Movement.
Okay. I have not read that.
That one's really good. Really, really liked it. Very, very well written. Lot of excellent references. And he kind of covers like a very wide spectrum in regards to movement. Goes into you would really like it because it ties into the neurological, the neuroscience.
Okay.
How the central nervous system is the kind of one of the main drivers for movement in the body, and he gives a lot of good reference and evidence examples that if you're working with an individual and you get them to make a change in the span of 5 to 10 minutes, it's highly unlikely, aka pretty much impossible, that you're going to be like physically changing the muscular tissue. That the most of the change is really going to be happening in the central nervous system. Now, that being said, that doesn't mean that using a foam roller or some other type of soft tissue release tool isn't useful, but what he's saying is that is what is a catalyst for stimulating and causing a change in the nervous system to allow greater range of movement or stimulus and promoting better movement patterns.
Yeah.
So good stuff. And then he goes into the pain science aspect of it. And then at the back of the book is probably 15 to maybe 20 plus exercises. And it's very, very, very detailed. So it's like, I love the way he wrote it out. It's here's the focus. This is the intent of the exercise. And then here's the execution. So this is the step by step. So this is what you should be thinking about mentally. And this is what you need to do. So it's great. Again, kind of going back to what you just said in terms of meditation, it gives you that center point for each exercise or drill, what you need to dial in on, and then all the steps to lay it out.
Sounds cool, man.
Yeah. So I got him coming on in a couple of weeks.
Oh, nice.
Yeah. So that'll be a good one. Well, this has been a blast. Just hang on the line. Let me give you a proper goodbye, and then we'll wrap this up. Do you got anything else that you want to say?
I just want to say thank you, and I appreciate you having me on. I think this is awesome what you're doing. I'm happy for you.
Thank you very much, man. I appreciate that. Me too. I think you're doing phenomenal work, and it's been a pleasure getting to rap with you over the last hour or so and get to know you a little bit better.
Yeah, maybe we'll meet up at SFG level 2 or something sometime, man.
That's right. Hang on the line. Let me wrap up the call.
Thanks for tuning in and listening to this episode of the Leo Training Podcast. If you enjoyed the content, I'd really appreciate it if you take a moment of your time, head on over to iTunes and drop in a 5-star review. It really helps the show grow and reach a new audience. Now, be sure to tune in next week when I interview Todd Hargrove, Feldenkrais practitioner, rolfer, and author of A Guide to Better Movement.
Thanks for listening to the Leo Training Podcast. Subscribe and get even more expert training tips at www.leotraining.io.